Good afternoon. We'll get started here in about a minute. This is Steve Mondernach with the Association of Food and Drug Officials. We're going to give it about a minute. We still have quite a few people logging in, and let those folks get logged in, and then we'll get started. Once again, we'll be starting here in about 30 seconds. Okay, we seem to be slowing down on logins. We'll go ahead and get started now. Welcome everyone to today's webinar. We're very pleased to have with us Dr. Donald W. Schaffner, who is an extension specialist in food science and a distinguished professor at Rutgers University. His research interests include hand washing, cross-contamination, and quantitative microbiological risk assessment. He has authored more than 170 peer-reviewed publications and educated thousands of food industry professionals around the world. He is a fellow of the Institute of Food Technologists, the American Academy of Microbiology, and International Association of Food Protection. He has served as the editor for Applied and Environmental Microbiology since 2005. Dr. Schaffner was the president of IAFP in 2013 and 14. In his spare time, he co-hosts the Food Safety Talk and Risky or Not podcasts. And if any of you don't listen to them, you absolutely should be listening to them. They're amazing podcasts and well worth your time. Well, let's go ahead and turn it over to Dr. Schaffner and for his presentation, Myth and Facts about the 5-second rule and hand washing.
Thank you very much, Steve, and thanks to AFDO for inviting me to be here today. I really do appreciate it. We should have plenty of time for questions. The topic today is the 5-second rule in hand washing, but it feels like all I've done for about the last month or so is talk to the news media about coronavirus risk from food and cross-contamination risk. And so if any of you have questions, and you'd like my perspective on that, I'd be happy to talk about that as well to make it a little bit more topical. And of course, this was a presentation that was supposed to have been given at a regional AFDO meeting, but of course, like so many things, that was canceled because of the coronavirus. So I really do appreciate AFDO giving me the opportunity to present this to all of you here today. So let's get started first on the 5-second rule. Basically, you can summarize the 5-second rule with 4 or 5 bullet points. The science around the 5-second rule really got started with Jillian Clark. Jillian was a high school student in Illinois, and she went to one of the faculty members in that department, in the food science department there, and for her science fair project, she basically inoculated tile with generic E. coli and then looked at the transfer of the E. coli to both cookies and to gummy bears, showing that you had transfer to those food products in less than 5 seconds. And so she got some fame and notoriety for that. She won the Ig Nobel Prize, which is not the Nobel Prize, the Ig Nobel Prize for that research, and everybody had a lot of fun. This has been a topic, obviously, that comes up in popular culture. The Mythbusters TV show weighed in 2005, and they concluded in their not scientifically peer-reviewed research that there was no difference between contact times of 2 seconds and 6 seconds, and so that's another perspective on the 5-second rule. Finally, in 2007, we had some actual peer-reviewed research. This research was done by Paul Dawson's lab at Clemson. Dr. Dawson has a history of studying interesting pop culture type things in his laboratory. And so this is, I think, probably the first one that he did. And what he discovered, what he showed in his published research in 2007 was that longer contact times between 5 and 60 seconds did increase salmonella transfer from wood, from tile, or from carpet to bologna or bread. But that increased transfer only happened after the inoculated surface was dried for more than 8 hours. My interest actually stems from a press release that came out of Aston University in the United Kingdom in 2014. And in this press release, they announced that contact time significantly affected the transfer of E. coli and Staphylococcus on carpet, laminate, and tile to toast, pasta, biscuit, and a sticky sweet. Now, it's important to realize that because they are British, when they say biscuit, they don't mean what we think of as a biscuit. They mean actually a cookie. And so I was interested in his press release. I don't know how much this impacted your world in 2014, but the news media was full of this. It just really was blazing around. Everybody was talking about it, and I wanted to find out a little bit more. We actually have been doing hand washing research in my lab for some time. I'll talk a little bit about that later, but I've also always been very interested in cross-contamination, and so I wanted to see what the science was behind this press release that was garnering so much media attention. And it turns out, when I asked to see the science, I was told that the work had not yet been peer reviewed, but that they did have a report. And so I asked for a copy of the report, and that report was simply a PowerPoint slide deck. And so that got me kind of irritated that here they were with all this media attention and people talking about cross-contamination, and they didn't actually have any peer-reviewed science behind their conclusions. And so at that time, I had a young graduate student just joined my lab by the name of Robin Miranda, and I said to Robin, hey, how about if you study the 5-second rule, but here's what we're going to do. We're going to do the research, we're going to do it right, we're going to submit it for peer review, and then once we get it published in the peer-reviewed literature, then we're going to issue a press release and let's see what happens. Well, it turns out that we did get a ton of press around it, and I'm pleased to report that we did that after publishing the research. Now, let me just tell you a little bit about the research. This is basically half of our study. It was published in the journal Applied and Environmental Microbiology. And you can find that on the internet. If you have trouble finding it and you'd like a copy, I'm happy to send you a copy as well. And we looked at this quite comprehensively. We looked at 4 different foods, 4 different surfaces, 4 different contact times, and then 2 different matrices, and we did about 20 replicates for each experiment. One of the things that we know from our hand washing research and from our other cross-contamination research is that there can be a lot of variability, and you can see that to a certain extent with the high error bars in some of these graphs. And so we wanted to be sure to capture that variability as well we could. And this is a little bit of an advice to any of you out there who might be graduate students or someday be graduate students. Robin came to me and she said, well, I don't know whether we should inoculate the surfaces using the cells in buffer or whether we should just inoculate them in the overnight culture directly without spinning it down and centrifuging it and then putting it into buffer. And I said, well, Robin, why don't you do both? And with that very, very short sentence, I turned her roughly 2,500 experiments into more than 5,000 experiments by basically doubling one aspect of her experimental design. But she was a trooper. She had a bunch of good undergrads helping her out, and they actually were able to get all of this data collected. And so what you can see here, and I realize this might be a little bit hard to see, but I'll walk you through it. So on the on the y-axis are the 4 different foods, right? So you've got bread at the top, then bread with butter, gummy candy, and then watermelon. And then across the top, you can see the 4 different surfaces. So tile, stainless steel, wood, and carpet. And then across the bottom, you can see the time in seconds, and we did basically a fraction of a second. So how quickly could they drop the item onto the surface and then pick it up as fast as possible? And then we did 5 seconds, we did 30 seconds, and we also did 300 seconds. Now one of the questions that you might not think about is, well, how did you do this? How high was the food above the surface that you dropped it on? And the answer is it had to be pretty darn close, because I don't know if you've ever tried to hit a Petri plate from standing height, but it's darn near impossible. And so we actually ended up just holding the foods just a short distance above the Petri plate to ensure that when we dropped the food, it would actually land on the Petri plate, on the surface in the Petri plate, and it wouldn't bounce around and go flying off elsewhere into the laboratory. So another thing that's really important to note is what the y-axis here. So along the y-axis, you can see the 4 different food products, but what is plotted there is something called the logarithm percent transfer. And I need to explain this a little bit, and we'll talk about this a little bit maybe in some of the subsequent work as well. But we know that the distribution, the statistical distribution of transfers is something that is log normally distributed. So in other words, if you were to plot the percent transfer from a series of experiments, that curve would be highly skewed. And anything, if you remember the very first statistics class you took, your professor probably told you that all of the statistical tests that you were going to learn about basically depended on the assumption of normality of the data. And so if you simply plot percent transfer, the data are highly non-normal. Now, what we've learned through our research on this topic over the years is that if you take the logarithm of those percents, that suddenly becomes something that's much more close to a normal distribution. And so that's what we plot here. And so if you have 100% transfer, that's a log percent transfer of 2. If you have 10% transfer, that corresponds to a log percent transfer of 1. 0 log transfer corresponds to 1%, and then -1 corresponds to 0.1%. Okay, and so what you can see is that there's a lot of variability, very high transfer rates for watermelon, and then somewhat more variability for the other surfaces. I'll also point out before I move on to the next slide, and you can see this pretty well with many of the carpet experiments, but you can see it with some of the tile experiments too, especially for bread and bread with butter up in the upper left-hand corner. For very short contact times, you actually have less transfer. And so for a fraction of a second with bread and bread with butter, you really don't get very much transfer. But if you leave it there for 5 seconds, you get significantly more transfer. You get a little bit more with 30 seconds, and then not much change between 30 and 300 seconds. So let's talk about, though, what really matters here. And so and you can see from this slide, what really matters is moisture. And so there was a reason why we chose to do experiments with watermelon. And that was because I knew from previous research that moisture, like you find in a piece of watermelon, is going to dramatically facilitate cross-contamination. And so basically what this graph says is that if you have tile, stainless steel, wood, or carpet, and you inoculate that with a high level of this marker microorganism, and you drop watermelon on those surfaces, you're essentially going to transfer basically all of the bacteria that were sitting on that surface. Essentially all of it, or most of it, is going to transfer to the watermelon. And it doesn't matter the amount of time. It doesn't matter whether it's a fraction of a second or whether it's 30 seconds or 300 seconds. Basically, that all of those bacteria move to the watermelon because of the moisture, right? And so the bacteria are sitting dry on the surface. You put moisture there, and they're just going to move into that moisture, and then that moisture is associated with the watermelon. So that was not really unexpected, but it was good to kind of have that there as a positive control to show what we kind of knew is that if you're going to drop food and eat it after it falls on the floor, don't drop wet food, because that's going to pick up all the moisture, all the bacteria that are there. Interestingly, we saw some different results with carpet, right? And so here, this shows panel D is bread, panel H is bread with butter, L is that gummy candy, and then P is that watermelon. And so what you can see, except for maybe the watermelon sample, what you can see is that we really don't get very much transfer off the carpet, both with bread, and bread with butter, and hardly any at all transferring from that gummy candy. Now, please don't think that this means that we should run out and advise that everyone carpet their kitchens, or that we should practice carpeting kitchens in restaurants. It's a really bad idea because carpet is very, very hard to clean, and you don't need a PhD to tell you that. But let's think for a minute why we got these results that we did. So remember, in these experiments, what we did was we loaded up each of those surfaces with a high concentration of a non-pathogenic or avirulent microorganism, right? And so if we're putting that onto tile, if we're putting that onto wood, onto stainless steel, those bacteria are going to sit right on the surface, okay? And there's nowhere for them to hide. And so as the culture dries, as the liquid that we inoculate them in dries, those bacteria are left sitting there right on the surface. With carpet, it's a different story. Now, this is not some 1970s style shag carpet, right? This is a very, very tight weave, indoor-outdoor carpet that doesn't have a lot of pile to it, but it does have some absorbency. And so what we think happened was we inoculated these carpet samples with the organism, but because the liquid soaked down into the carpet, most of the bacteria moved down into that carpet, and they were not sitting there at the surface of the carpet. Now, when we dropped watermelon on the carpet, that moisture from the watermelon actually essentially sucked those bacteria out of the carpet, right? Much in the way that you would if you were cleaning a carpet with soap and water. That liquid would motivate those bacteria or move those bacteria out of the carpet. If you drop something that's relatively dry, like bread or bread with butter, and especially with the gummy candy, basically those foods excuse me, are going to sit on the surface of that carpet. They're not going to press down too much, and there might be a little bit of pressing down, which is why you see the results with the bread and the bread with butter. But the gummy candy essentially sits there on the top of the carpet and comes into contact with a little bit of the bacteria. You do get some transfer, but most of the bacteria actually stays in the carpet. So, well, where does that leave us in terms of the answer to the question that we originally set out to answer? Is the 5-second rule true? And it turns out it kind of depends upon what you mean by the 5-second rule. If you interpret the 5-second rule to mean, is there some amount of time that is safe for dropping foods onto a surface, our research clearly shows that that's not true, right? No matter which surface, which food, or what time, we saw at least one experimental replicate where we saw some bacteria transfer. And so there was no quote unquote safe amount of time for which we got no transfer. So on the one hand, if that's your interpretation of the 5-second rule, then the 5-second rule is not true. On the other hand, if you rephrase it and you say, does the amount of time that some foods sit on a surface make a difference in terms of the amount of bacteria transferred? Well, our research also shows that that is true. In some situations, depending on the food and depending on the surface, contact time can have what can be sometimes a profound effect on the number of bacteria transferred. And these tend to be the experiments with carpet, although we did see it with some of the other surfaces as well. And so does contact time influence transfer? Well, the answer is yes. In fact, it does. And then, of course, as I said, despite the low transfer rates from carpet, probably not a good idea to carpet your kitchen anytime soon. All right, so now we'll move from the 5-second rule part of the talk to the hand washing part of the talk. And here I've got a couple of different papers that have come out of my lab that I'm going to weave together into what I hope is an interesting story for you. So first of all, a lot of this research was done by my graduate student, Dane Jensen. And this is a nice little paper that we published in Food Protection Trends in 2015. And what he did was he basically went out on the internet and he looked at the multitude of different hand washing signs that are out there telling people to wash their hands. And he did essentially what was a quantitative analysis of those recommendations. And he found 81 different hand washing signs. And here's what he found, right? So basically, signs had different steps that were indicated. So a lathering step. There were 37 signs, or roughly 45% of the signs recommended lathering of some amount of time. The average amount of time indicated where the time was indicated was 18.4 seconds. The median time was 20 seconds, but there were some signs that recommended lathering for 10 seconds, and then of course the maximum was 20 seconds. Only 3 hand washing signs that he found recommended a rinse time. And so that rinse time ranged from 10 seconds to 20 seconds with an average of about 13 seconds. There were 58 signs that indicated some sort of overall time for the hand wash, basically the lather and the rinse together. And that ranged from a median of 20, a minimum of 10, a median of 20, and a maximum of 60 for an average of about 22 seconds there. And then there was about almost 30% of the signs said to people to wash their hands, but didn't actually indicate a time. And so what this says to me is that there's a lot of inconsistent messaging out there. So no wonder people are a little bit confused when it comes to washing their hands. So with that, I'm going to move on to the next topic, which is antibacterial soaps. And this is one area where we've gotten involved in some research that I want to share with you. And this is from another paper, and it's just, I'm not going to tell you about the whole paper, but I do want to share this one particular slide because I think it tells a pretty important punchline when it comes to antibacterial soaps. So this is a summary of the literature at the time. This was research that was published in the I think the mid to late 2000s. Actually, sorry, it was published within the last 10 years. It's been published. So, and what it compares is the relative frequency of log reductions for non-antibacterial soap versus antibacterial soap. And what you can see from the error bars on the top is that antibacterial soap or antimicrobial soap is slightly better. It's on the order of a 1/2 log better in terms of its effectiveness, which may seem small. I mean, a 1/2 log is barely significant to a microbiologist, but it ends up making a real difference. Now this is a little bit of a moot point right now because the most popular antimicrobial triclosan is not allowed for use in over-the-counter hand washes sold to consumers. It is still allowed in food service, and it's allowed in hospitals and things like that, and food processing plants. But for now, it's not allowed for consumers, and so it's a little bit of a moot point. Although there are other antibacterials that are allowed. So this was our first foray into research on antibacterial soap. Our second foray, we answered the question: does this small but real difference actually have any real effect on risk? This is from a different paper. And what this paper shows is 2 bland soaps, that is non-antibacterial soaps, and those are depicted by panel A and panel B. And then we looked at triclosan, we looked at CHG, which stands for chlorhexidine gluconate, which is another popular antibacterial compound. And then we also looked at an ethyl alcohol hand sanitizer. And so this is a computer simulation. It's based on real world laboratory data. And basically what we said was, let's imagine a food service worker who's sick with Shigella. And this food service worker has 1 million Shigella bacteria on their hands, and they've been tasked with basically making melon balls and serving them to customers. And so what we said was, okay, let's imagine this ill food worker has 1 million Shigella on their hands. They're going to wash their hands either with plain soap, or they're going to wash their hands with antibacterial soap, or they're going to use a hand sanitizer. And then after they do that, they're going to handle the melon balls, and then we're going to feed those melon balls to people inside our computer simulation. And so what the data show are the simulated number of foodborne disease cases from 100 people being exposed to these contaminated melon balls. And then we because it's a computer simulation, we can do the experiment over and over again. And so we essentially ran this experiment 10,000 times in the computer, and we predicted how many people got sick. And so what you can see here is the title of the slide, No Such Thing as Zero Risk. And so no matter what you did, because you started with 1 million Shigella on the hands, somebody's going to get sick at least some of the time. But what I hope you can also see is that the median number of people that are sick from the plain soaps without antibacterial agents, that's around 50%. Around 50 out of 100 people get sick on average. Some simulations, it's almost 80 people that get sick. Some simulations, nobody gets sick. But most of the time, around 50 or 60% of the people, 50 or 60 out of the 100 people get sick. As you move to the antibacterial products and to the ethyl alcohol, what you can see is those curves shift significantly. They're no longer normally distributed, and now very small fraction of the time do you see 60 people getting sick, and very often you see only about 5 or 10 people getting sick. Sometimes you even see a significant number of simulations where no one gets sick. And so basically all of these three interventions work better at reducing, none of them is perfect at preventing illness, but all of them work to reduce illness, at least according to the results from our computer simulation. So this next bit of research comes from a different paper, and this is more research done by my graduate student Dane Jensen. And Dane was real interested in what he calls the splash and dash, right? And so what the splash and dash is it's a 5-second hand wash with no soap. So and he wanted to compare that to the model food code recommended 20-second hand wash, so 15-second lather time followed by 5-second rinse with soap. And what you can see here, and so on the left hand axis, on the y-axis, you can see this is the frequency. This is the number of times that we observe something happening in our experiment. These were experiments done with real human volunteers where we inoculated their hands with a marker bacteria, an avirulent strain of Enterobacter, and we studied what the effect of washing with just plain water for 5 seconds would be versus with soap. And what you can see is that we get about a 1 log reduction most commonly with the 5-second splash and dash. So what that means is that if you're pressed for time and all you can do is a splash and dash, that's actually better than nothing. It's actually significantly better than nothing. You get, on average, about a 90% reduction. But of course, if you take the time and you use soap and you wash for 20 seconds, you're going to get a much better effectiveness. You're going to get about a 2 to 3 log reduction. So somewhere around a 99% or even a 99.9% reduction. And obviously there's more variability. Some people, despite following the food code recommendations, they do a pretty poor job of getting bacteria off their hands, and other people do a pretty good job getting as much as a 4 log reduction, although again, a small number of people getting only a 1 log or even a less than a 1 log reduction. The next little bit of research I want to share with you is some research, and I think this is part of the same paper, but it's another bit of paper from Dane's PhD research, which is the benefit and perhaps the risk of paper towels. And so what we did here was we compared paper towel versus air drying hands. Now, we didn't use one of those hot air hand dryers. We just had somebody stand there in the laboratory until their hands were noticeably dry, and then we recovered the bacteria. And what we found was we actually got about a half a log benefit from using a paper towel. So there was a benefit of removing bacteria by use of a paper towel, and that difference was statistically significantly different. Now, it turns out, however, if you start with a whole lot of bacteria on people's hands, which we did for these experiments, the risk side is that those paper towels actually can have a significant level of bacteria on them, and that's what's depicted in the figure there. And what you can see, the black bars are for the first paper towel, and the gray bars are for if somebody used a second paper towel to dry their hands. None of the volunteers used more than 2 paper towels. And what you can see is that in some cases, we had 1,000 1,000 or 10,000, even 100,000 bacteria on those paper towels in one case. And so paper towels definitely do give you a benefit, but they also can constitute a risk if you've got a high level of pathogens on your hands. Those pathogens that don't get removed in the hand wash, some of them may end up on the paper towel. All right, the next bit of research I want to tell you about is some research that we did with bulk soap. For those of you that don't know what bulk soap is, it is basically a soap product that comes in a pump container, but that can be refilled easily. So many of the containers that you see, well, all the containers you see in hospitals is not refillable, right? So it's got this plastic insert. When the soap is all done, you pull out that plastic insert, you throw it away, or maybe recycle it and put in a clean one. But that's what is required now in hospitals. In food service, that's not the case. You can have these open, refillable containers. And what we think, I don't have time to talk about all of this research today, but what we know from this research is, what we think from this research is that people will dilute the soap in an effort to save money. And if you dilute the soap enough, you actually can get colonization of these soap dispensers by bacteria. So in this particular research, we sampled almost 100 samples from each of 3 states, Arizona, New Jersey, and Ohio. 85% of the soap samples we tested had no detectable microorganisms. So that's good. But what that means is that 15% of the samples tested did contain microorganisms. And the really shocking thing is, once the preservative system in these soaps breaks down and a soap dispenser becomes colonized, the most likely level of contamination you're going to find, if you're in that 15% of samples, is about 7 log CFU per ml. We've actually seen outbreaks, not food poisoning outbreaks, but we've actually seen outbreaks of hand infections occurring that have been traced back to contaminated soap dispensers. Some of the bacteria that we found include Klebsiella, Serratia, Shigella, Enterobacter, another species of Serratia, and then another species of Enterobacter. And some of them were also antibiotic resistant. And so I personally think bulk soap dispensers are a bad thing. I'd like to see them removed from use. I'd like to see the food code, the model food code specifically not allow them, but we're not there yet, and maybe we'll get there someday. So that's my pardon the pun, soapbox on bulk soap. Let's move on to as we wrap this up. Let's move on to the last data slide, and this is looking at the effect of water temperature. And basically, what this shows is the energy consumption based on 1,000 hand washes, depending upon whether that water temperature is 15, 26, or 38 degrees C. And basically, you can see that the hotter the water, the more energy is spent heating that water. So energy usage definitely differs between water temperatures, but in terms of the microbiology, it turns out it doesn't make a difference. We had people wash their hands in water that was 100 degrees, 80 degrees, and 60 degrees. That corresponds to 38, 26, and 15. And we did not see a statistically significant difference in those temperatures, those water temperatures. And so my advice there is you should use a water temperature that is comfortable for you, because it doesn't matter in terms of the effectiveness of the hand wash. So how should you wash your hands? Well, let me try to weave together all of the previous data on hand washing. Anything is better than nothing. So a 90% reduction with a splash and dash is better. It's better than doing nothing. Of course, if you can take the time and you can do a proper food code hand wash, that's better. I've actually been working with my colleague, my podcast partner, Ben Chapman, on some research at North Carolina State, which basically provides a lot more data to basically cement home this idea, knowing that people don't do a great job washing their hands, but the more they try to do a good job and the more times they tried to wash their hands, the better the job they did at preventing cross-contamination in the kitchen. And so we're working that up for publication. And so maybe the next time I give this talk, I'll be able to share some data from that research. Also, I want to say here that hand sanitizer is better than nothing. And in some cases, it may actually be better than soap. I didn't have time to talk about it today, but I think we've got some data. It's not definitive, but we've got some data that shows that there's less person-to-person variability in how we apply hand sanitizer versus the personal variability in how we wash hands. And so if you've got hand sanitizer around, it's a good thing to use. And these times of coronavirus, I think especially so, we know that this particular microorganism is not especially resistant to ethanol or to isopropyl alcohol. So hand sanitizer is a good choice if you're trying to prevent coronavirus. Using soap is, of course, better than using no soap. Antibacterial soap, I would suggest, my data suggest, is better than just plain bland soap. Remember that paper towels remove bacteria, and they do also help to dry hands, but they can also become contaminated. Why is it important to dry hands? Well, let's think back to the first bit of research on the 5-second rule. Think about your wet hands touching the doorknob as you leave the restroom as kind of like dropping that watermelon on the dirty surface, right? If your hands are wet, you're going to actually get some potential transfer that you wouldn't see if your hands were dry. My recommendation is to avoid bulk refillable soap dispensers. I think they're bad news, and we need to get them out of restaurants and food processing plants because if they're not contaminated most of the time, only about 15% of the time. But if they are contaminated, chances are they're fully colonized and they've got high levels of microorganisms in them. Finally, water temperature does not matter. You can use whatever water temperature you think is comfortable. We did try a few years ago to get this changed in the food code. Food code doesn't specify temperature for washing your hands, but the plumbing section of the code does specify that the water must be capable, the plumbing must be capable of dispensing water at 100 degrees Fahrenheit. It's my opinion that is a recommendation that is not based on science. So water temperature does not matter, according to research in my lab and others. And then finally, remember, hand washing is not magic. If you do a really good job, you'll get about a 99% reduction, but you won't get enough to remove millions of bacteria from your hands. And so obviously you need to pay attention if you're handling things that are going to put millions of bacteria on your hands. You probably want to try a hand wash, a hand sanitizer, maybe some glove use thrown in there too. Bottom line is, if you have norovirus or you have Shigella, I don't want you anywhere near my food. I don't care how good your hand wash is, because hand washing is not going to mitigate that risk. So with that, let's move to my last slide and ask you, which hat are you wearing today, right? If you're wearing your risk assessment hat, as I've been wearing for most of my talk today, you're asking the question, how big is the risk and what factors control the risk? And you're doing that in a scientific way. If you're wearing your risk management hat, which I suspect many of you are wearing today, you're asking the question, what can we do about the risk? What can we do about getting people to wash their hands better and knowing the effectiveness of hand washing? And so risk management is really a societal practice. It's a practical process. It's a political with a small p process. And so hopefully the data that I've shared today, the risk-based data I've shared today, will help you as you go out and manage risks. And then finally, remember that what we've been doing, all of us here today, is communicating about risk. How can we talk to the affected individuals about risk? And remember, that's a social and a psychological process. And now, in the theme of risk communication, I'm going to open it up for questions, and I'd be happy to answer any questions you have about anything I've talked about today, or anything that you might want to know about COVID-19 and food. So with that, I will turn things over to our organizers, who are going to vet those questions and share them with me.
Sure. So it looks like we have several questions coming in. Once again, if you have a question, go ahead and put it in the question box. We're going to be using the question box today versus hand raising. So if you do have a question, go ahead and type it in the question box. Our first question is, can you use the 5-second rule study to infer that fabric would be less likely to transfer coronavirus, even though the virus might still be viable?
Yeah, that's a really interesting question. I've been thinking a lot about this because of reusable grocery bags. I like using reusable grocery bags. My current grocery store, my favorite grocery store in my neighborhood, does not allow them now. And so, yeah, I suspect that you would get significantly less transfer from a hard surface to a cloth bag and vice versa. One of the things that we hope to do, it's probably not going to be this summer, and well, I don't know. At some point, my laboratory will open back up. And when that happens, I do want to do some work. We won't be working with the coronavirus itself, but we're going to use an envelope bacteriophage that we think is a reasonable surrogate. And I'm going to be studying cross-contamination between dry surfaces and cloth bags and other things, because I think it's going to be interesting. My bet is that you're going to see very little transfer from surfaces to cloth bags and vice versa, especially if there's no moisture involved. If there's moisture involved, I think you're going to see some significant amounts of transfer. So that would be my guess and my hypothesis going into research that we will hopefully be able to do someday.
Great. The next question we have is, although water temperature does not affect bacterial load on hands, would water temperature affect the removing of the soap and oils from the hands?
That's a good question. Obviously, we do know that, so that there's two things. Number one, there's the oils and the lipids that are naturally on your hands, but then maybe the oils and the other debris that you maybe have from handling food would also be on your hands. And so obviously, water may have an effect there. Water temperature may have an effect there. If I'm remembering our hand washing research correctly, I think we used hands that were inoculated. Let me see if I can get back. Yeah, that's a bad figure legend there, Don. Yeah, I don't have the data here, but I believe we inoculated. I don't want to say. We might have inoculated, put ground beef on people's hands. Or we may have just used the actual broth culture or dilution buffer. So yeah, so there's a possibility that the matrix will have the matrix that you use to put the bacteria in on the hands will have an effect. But yeah, it's a good question. It's one that remains to be studied.
So the next individual had a question about, in terms of hand washing confusion, have you seen a study that shows the difference between instructions that only include up to the point of using the paper towel to turn off the faucet versus those that then take the next step of using the paper towel to open the door and then throw the towel in the trash? It seems like a lot of instructions stop at using the paper towel to turn off the faucet. Any thoughts on that, Dr. Schemmer?
Yeah, that's a really good question. In our survey of Handwashing Signs, we did not see any recommendations to that effect. But obviously, I think that probably is a best practice, right? Using the paper towels to turn off the faucet is good, and then using the paper towels to exit the restroom if there's not a touch-free way to exit the restroom. A lot of restroom doors, I think, open outwards, and so you can often get out without pulling the handle, but that is not always the case. So yeah, but certainly it's a best practice. I don't think that we actually saw any of that recommended in any of the hand washing signs that we found. And those, I have to say, those were found by searching the internet. We didn't actually go around and look for hand washing signs. Although my former graduate student will occasionally send me a text with a picture of a funny hand washing sign that he's encountered that was not part of our original survey. But thanks for the question.
Yep. The next question is, many cities have strong water conservation efforts going on. What is the limited amount of water or the lowest amount of water that ought to be used for initial and post-rinse and hand washing? Any ideas on that question?
Yeah, that's a really good question, and it's one that we had thought about studying. We had to eventually, Dane had to graduate. He had to get his PhD, and so we ran out of basically experimental variables to look at, but that would be a really interesting one to look at. What is the effect of, we did study soap volume. It turns out soap volume doesn't have much of an effect, but water volume would also have an effect. There's probably also an interaction with technique. So in other words, if you have bad technique for hand washing, adding more water may give you some benefit. So, but if you don't have much water, I suspect that technique, you may see that technique come more into play. But again, I'm not aware of any research that specifically looks at that.
So the next one I think is a popular question that I think I see it asked about 3 different times amongst the various questions. The question is, do air dryers increase exposure to bacteria?
Oh, I think the short answer is yes. And the complicated answer is it depends, right? It depends upon the design of the air dryer. It depends upon the nature of the contamination in the restroom. We know that restrooms, if you have aerosolization from toilets, you can get pathogens in the air. So yeah, but those factors can come into play. And the other thing too, I will add, while I've been listening and answering questions, I've also been searching for this paper to get back to the question about water temperature and ground beef. It does look like in this one, I guess we didn't. I'm just trying to think. It looks like we didn't study water temperature in this particular set of experiments, but we did look at ground beef, and it turns out there is an interaction of ground beef and soap use, but I guess it doesn't answer the question about water temperature. So anyway, my apologies.
Great. The next question is, has there been any research about bacterial resistance and how antibacterial soaps play into that?
That's a really good question, and this is basically, it's an area that's outside my area of expertise, but it is within my area of interest. And so for sure, that was the big reason why FDA CDER decided to move forward with a ban on, effectively a ban on triclosan in antibacterial soaps for consumer use, is they felt that there was the possibility for the development of antibacterial resistance. There's a possibility of triclosan getting into the environment and causing negative ecological consequences there. And so definitely could be problems there. I still do think that there is a benefit, and so hopefully we will be able to preserve that category of food, that category of soap for use in food service, even if it's not available for people to use over the counter. So yeah.
So our next person is asking about in their homes. Should I be using a hand towel in my home, or should we be using single-use paper towels in our home?
That's a really good question, and let me tell you what we use in our home. We use both, right? And so what I would suggest is, if you are in a situation where you know that you've just been handling something risky, right? You've just been boning chicken, you've been making ground beef patties, I would suggest after you wash your hands there would be a good time to use a paper towel. If you've just been doing something that doesn't involve, that doesn't likely result in your hands being contaminated, then we'll use a cloth towel or a dish towel, and then of course after that's been used in probably for a day or maybe 2, that goes in the wash. But I would say again, what we do is more on a case by case basis.
So the next question, actually, there's a handful of these too. What about bar soap? Is bar soap better or worse than liquid soap?
Yeah, that's a real question. Bar soap definitely doesn't have the problems with contamination that you see with bulk soap, right? Because it dries out, and so you don't have the opportunity for colonization. Essentially, bar soap is gone from, you certainly don't see it in hospitals. You rarely see it in food service establishments. The only place to see bar soap is in people's homes. You'll see it in hotels, I suppose. But again, that's typically a bar soap that is single use for the occupant of the hotel room, and then I guess gets reprocessed at the end of the hotel stay. It doesn't get recycled for the next user. So I think there was some published literature on bar soaps. Apologies, that's my dog. There was some published literature on bar soaps and some sparring editorials going back and forth. These are quite old now. I've been meaning to take some time to dig into them, maybe for an episode of Risky or Not, but have yet to do that. But basically, I think the bottom line is that there really is not much of a risk from bar soaps, but they have effectively been eliminated in all but in home use situations.
It looks like the next question that is interesting is, many restrooms are equipped with the Dyson Airblade hand dryers. And often the air blades cause one's hands to come in contact with the surface of the dryer, etc. Does that increase the risk of cross-contamination or contamination from the dryer?
Well, I don't think this has ever been studied, but based on what we know about cross-contamination, I would say yes. So I would imagine a scenario where person A comes in and they've got, bacteria or virus on their hands. They wash their hands, but they've got high levels on their hands. As they put their wet hands into the air blade, they touch the side of the air blade with the moisture, with moist hands, and they'll transfer something to the air blade. I don't know the ability of the air blade. Certainly, it's moving the moisture, it's moving the air through a filter, but I don't know if you were to deposit something on the surface from a contact with a wet hand, what that would do. Assuming that stays there on the device, somebody else comes in now with clean hands. They've just washed their hands are still clean, and then as they put their hands there, they again with wet hands touch that same spot, and now they've effectively transferred a significant amount of what was there to their previously clean hands. Again, that's speculation on my part. We've not studied that in the laboratory, but I don't think it's that far-fetched to suggest that is a possibility.
So the next question is COVID-19 related, and it's maybe a practical question for someone like me too. So when buying fast food, why is it I should be worried about contracting COVID-19 from the packaging, but not from the food itself?
I don't think you should worry about getting it from either one of those. The FDA says there's no evidence of transfer. There's no evidence that contact with food or food packaging puts one at risk for COVID-19, and so I think that they're both no to low risk for a variety of reasons. We see a lot of transmission of cases from people who are symptomatic, coughing and sneezing. I think that's by far the biggest risk, being with someone who is actively symptomatic. We have some examples of asymptomatic spread, although examples of those in the published literature are rather small. They do seem to indicate that you have to be in close proximity to somebody over an extended period of time, or in physical proximity in very, very nearly adjacent time. There's one case in a church in Singapore where a couple that was infected sat in one location in the church, and then a person that came and sat in that location apparently immediately after them, did contract the virus, even though they were not in the same space at the same time. They were in the same space at slightly different times. So those are the primary ways it's transmitted. We don't have evidence that it's transmitted by food or by contact with food packaging. Probably the reason for that is that the receptors for the virus, there are receptors for the virus in the lungs. We don't know if there's active receptors in the esophagus or the intestine, and so there would need to be receptors there, which there's at least some non-peer-reviewed research that indicates there's receptors there, but we're not sure if the receptors are active and can actually bind the virus, and the virus can actually be taken up by those cells. So that's the answer for now. And again, as with all these COVID-19 things, we have to say that's the current state of the science as far as I know it today here on Monday, April 13th at almost 4 p.m. Eastern time.
The next question is, could you give us an example of what you mean by a bulk soap dispenser? Someone wasn't quite sure what that meant.
It's basically, it's a soap dispenser that you can see how to refill, right? And so certain restaurant chains don't have them, but some restaurant chains do. I don't remember now off the top of my head which ones are which, but basically, if it's mounted to the wall and it looks like you need a special key to open it, it's probably not a bulk soap dispenser, right? But if it looks like if it's a little hand pump thing, and it's sitting in a convenience store at a rest stop, that's a refillable soap dispenser. If it's not sort of the box and bag style, if it just has an open dispenser where you open the top and you just when it gets low, you pour more soap in the top. That's a refillable bulk soap dispenser. So yeah, it's about the best explanation I can give. I guess in the next time I give this talk, I probably should put some slides in with pictures of what I mean by a bulk soap dispenser. So yeah, sorry about that.
Oh, the next question is air dryers. Should they be used in food facilities, food establishments, and food manufacturing plants?
My personal opinion is no. I don't like them. I don't think they're effective. I don't think they're effective at getting your hands dry. So if I ran the world, we wouldn't have them. Unfortunately, I don't run the world, and so it's not up to me. but I really don't like them.
One more COVID-19 question. Any thoughts about how cleaning and sanitation for food contact surfaces should be conducted with COVID-19?
Yeah, I don't think that there's any evidence we need to do anything any differently than what we're already doing for normal food safety. Now, it becomes a little bit more complicated when you have a worker who's diagnosed as being sick with COVID-19, and there you probably do want to go in and follow. You can find recommendations on the CDC website for disinfection procedures in those situations, but that's not for food safety. That's for person-to-person spread within the facility. So again, I would direct you to the CDC has some really amazing COVID-19 advice out there, and you can drill down pretty quickly to what to do if you have an infected workplace. They don't specifically talk about food. They're more talking about like an office building or something, but the same technologies apply. EPA has their list of sanitizers or disinfectants they believe to be effective against COVID-19 or the novel coronavirus. And so you can get that link from the CDC website if you can't find it on the EPA website. So lots of good information out there.
Well, I think we're going to do maybe one or two more questions depending on how quick you can answer them. The next question relates to temporary events, and have you looked at the use of portable hand sinks versus hand sanitizer for those temporary outdoor type events? Any thoughts on that?
Yeah, that's a good question. I'm a big fan of hand sanitizer. I really think that we should, again, if I ran the world, right, file this one under if Don ran the world. I really think that there are situations, even in conventional food service, I know this is heretical to say, but I think there are even times when we have access to hand washing, when a hand sanitizer is an acceptable alternative. For example, if your hands are not visibly soiled. I would love to see the food code change to reflect allowing people to use hand sanitizers if their hands are not visibly soiled. We even got some data in my lab that shows if your hands are slightly soiled, and there's other published data out there as well that shows if your hands are even slightly soiled, you can still get a benefit from using hand sanitizer. And so I would really like to see greater adoption of that because I think it's an effective technology. I think, again, see my earlier comment, there's less person-to-person variability in how people apply hand sanitizers. Friction is no longer a concern. It's just a matter of getting the alcohol on all of the surfaces of your hands. And so technique, I think, plays less of a role. So so let's come back and answer the question. I think in those temporary establishments, yeah, I absolutely don't have a problem with hand sanitizer. It's probably more cost effective, and it's probably at least equally as effective as having a hand wash sink there. Now, when you might want to have a hand wash sink is when your hands are visibly dirty, you've just been digging in the dirt, or you've been mucking cows or something, and you want to get that physical dirt off your hands. Nothing beats a soap and water for that. That's what it's really designed for.
We'll call this the last question. And the question is, does a hand sanitizer have an immediate effect on bacteria, or does it take some time for it to have an impact on the bacteria?
That's a good question. It depends upon the nature of the antibacterial agent. When I say hand sanitizer, most of the time I'm really talking about alcohol-based hand sanitizers. There are other hand rubs that are antimicrobial that have other ingredients in them, and those may take longer to work. But basically, from what we understand about the mechanism of action of alcohol, it's pretty disruptive to the bacterial membrane, and it's pretty instantaneous. Again, works really well against enveloped viruses like coronavirus. Does not work so well against non-enveloped viruses like norovirus, but there are some tricks you can do to basically change the formulation and adds additional ingredients that help it be more effective against norovirus. But most traditional hand sanitizer is not. Although, like I said, works great against bacteria, especially the gram-negative, and it works great against envelope viruses.
Oh, thank you very much, Dr. Schaffner. I will tell you there's still about another 30 questions we could go through. You've definitely generated lots of questions from the audience, and an audience that's really interested in this topic. But it is time to wrap up. We're at the bottom of the hour, in fact, a minute or two over. We really appreciate you presenting this information today. It was a fantastic presentation, as always. Thank you very much for being a part of today's presentation.
Thank you for the invitation. It was my pleasure.
Have a great day. Well, thank you all very much. We appreciate you participating today. You will be receiving an evaluation probably first thing tomorrow morning. We always appreciate getting feedback, and if you have any topic suggestions, don't hesitate to include that also in your feedback. Thank you all very much, and have a wonderful day.